When we talk about health, it's much more than broken bones and trips to the doctor. So many things play a role in every person's health and well-being. From the water you drink and the air you breathe, to the people in your support network and the neighborhoods where you live, work, and play. In Placer County, we're lucky to live in one of the healthiest communities in California. Yet there's still a lot of work to be done so that every single member of our community has the opportunity to flourish. At Placer County Health and Human Services, we're working together with our community every day to build a healthier future. Our divisions deliver and champion cutting-edge services that aim to help our residents become self-sufficient and have a great quality of life. Here's a quick look at some of their work.
Our Human Services Division runs public assistance programs for families in need to help with food, healthcare, and employment. We work with them to build a solid foundation with these basics so they can realize their full potential and become contributing members of the community. Did you know that for every $5 spent in CalFresh food assistance, $9 in local economic activity is generated? Not only do these programs help families get on the right track, but they also boost our local economy and businesses. Human Services also runs our county's Housing Authority, which is responsible for a variety of programs to help offset housing costs for Placer County residents with low incomes, and has recently added the Veteran Services Office, providing support to our county's servicemen and women.
I found the support from the CAFIC program. It helped our life will be better. Now I have a more chance to buy food, more opportunity for us to have a better and healthy food for my kids, and it makes our family health will be better.
Our Children's System of Care Division focuses on the health and well-being of Placer County's children and their families. Our child welfare team works 24/7 to help children who are at risk of abuse or neglect live safe and healthy lives. We support families to try to keep children at home and healthy, but when a child must be removed for his or her safety, we help place them with loving foster or adoptive parents. For those children who cannot return to their parents, we also try to find permanent, forever homes with families who want to adopt. Our division also helps children and youth with mental health, substance use, or other challenges so that they can grow into healthy and happy adults.
They have been a total blessing for my family. They've helped me with parenting classes, encouraging me to change my way of thinking of how to deal with trauma children.
Our adult system of care primarily assists adults with mental illness and substance use needs to get on and stay on the path of recovery. That includes connecting clients with whatever levels of services fit their needs, from outpatient counseling programs to more intensive inpatient residential treatment programs, and even just a safe place to connect. We also run programs for people experiencing homelessness, offering services and creating supportive housing. Our growing senior population and disabled individuals can receive varying levels of support, such as our in-home supportive services program, where we hire caring staff to support people in their homes with daily tasks. Finally, we offer specialized services day and night to those in crisis and the most vulnerable in our community.
There's people there that care and stuff instead of actually just, like, hi, here, take a number, and, they're genuinely concerned about, that's what it's all about, and that's what helped me the most.
Our Public Health Division's primary function is to promote health and protect our community against disease and injury. That includes working with hospitals and healthcare systems to monitor for diseases, everything from rabies to whooping cough outbreaks, but also preventative efforts, such as promoting good dental hygiene, vaccinations, and healthy nutrition. We also prepare for emergencies and disasters that could come our way, anything from fires to floods. Plus, it's this division that heads up our Whole Person Care program, an innovative new effort targeting homeless individuals with significant challenges, including health problems.
Working in public health really let me follow my passion, looking at individuals, families, communities in a holistic way.
Lose your dog or just looking to adopt a new one? Animal Services has you covered. Our animal control officers are on call 24/7 to pick up strays and deal with noise complaints and other disturbances. We adopt out hundreds of pets a year from our new facility in Auburn, including dogs, cats, rabbits, birds, and a few more unusual species.
When you find an animal and you can reunite it with its owner, and then you find out that it's been lost for 2 months, and that you're able to provide that reunification, that safe reunification. That's awesome.
The Environmental Health Division works behind the scenes at many things people may take for granted. Making sure your drinking water is clean, or that the food from our local restaurants is safe, or when you go get that new tattoo, you end up with a work of art and not a painful infection. Our staff help clean up during hazmat incidents and also help ensure that new building projects are safe from hazards like soil contamination.
I live here and I drink the water here and I eat the food here, and so do my kids. So we're regulating this is our home. We don't like to come in and wag our finger and tell people you can't do this, you can't do that. We try to educate and tell them, maybe you can do this, have you thought about doing this, maybe we can work around this and other ways so that they can succeed and make money and have a thriving business, but also not make people sick.
And finally, our administrative division is the financial backbone that helps keep the rest of the department running smoothly. We handle money coming in and out of the department, from the usual stuff like payroll to oversight of funding allocations and grants. We also manage contracts with nonprofit organizations who provide services to the community.
I feel like we are the assistants to superheroes, basically.
The more than 800 staff members who make up Health and Human Services work together to tackle tough issues facing our community and come up with real, attainable solutions. We hope you'll join us as we strive toward a healthier community.